And now, In Touch with East Texas, a 30-minute program dedicated to helping those in our community. Now, from our studios at 210 South Broadway here in Tyler.
Good morning, this is Brian Pearson, and welcome to In Touch with East Texas. My guests today are Carrie Ann Fisher, and she's the Executive Director of Itwet, and we also have Lynn McGinnis, who is Vice President of Development, and Julie Miller, who's a founding volunteer, and we also have with us Phoebe. And what kind of dog is Phoebe?
Phoebe's a chocolate lab mix. She's a rescue.
She's a rescue. How did you find her?
My husband found her in the middle of a highway.
That's a definite rescue situation there.
Definite rescue situation.
Did you fall in love with Phoebe immediately?
Immediately, although I did make him take her to a pound to give the owners an opportunity to find her. She had a collar on, but no tag. No one ever showed up, and 10 days later they called us and said, if you want her, come get her. And yeah,
she's a happy little thing.
She's a very happy little thing. She landed on her feet, that's for sure.
She seems a little small for a Labrador.
Right, that's why I said mix, because I have no idea what's going on. DNA would be fun.
Okay, so Itwet in Tyler is a relatively new nonprofit. I remember, isn't it? Or did you? Because I remember going to some kind of a grand opening or a ribbon cutting a long time ago. So.
Well, that was on our new facility.
Okay.
Itwet's been here over 20 years.
20 years.
23.
23 years. Well, you know, because you founded it.
I've been here since the beginning.
So how did you tell us the story about how it got founded?
An occupational therapist from Dallas came to work at one of the rehab hospitals here in town and wanted to bring what she was doing in Dallas here, which was the animal-assisted therapy concept. And so at that time known as Tyler Rehab, now Christus Trinity Mother Francis Rehab Hospital, affiliated with Health South. The program is still in existence, and we started there and have expanded ever since.
Okay, what can you tell me about the history of the animal-assisted therapy concept? How long has that been around? I mean, I know animals have been therapeutic for thousands of years, but when did they discover that they could be used in the situations that they're in now?
Back in the 1960s, there were some programs in Pennsylvania that were working with psychiatric patients as well as children, and they noticed that the human-animal bond drew them out in a way that nothing else did. And we've seen that certainly here in Tyler, where stroke patients will move for an animal where they won't move for anyone else. We've had patients in comas start to pet an animal where they didn't respond to the nurses or the doctors who were asking them to do something. So there's definitely some kind of connection in the brain that an animal hits that traditional medicine doesn't.
Oh, that's great. All right, so let's talk a little bit about what the program does.
Well,
Be you, Carrie.
We do a lot of different things. One of the things that I think Itwet has been very good at is looking at different ways to utilize animals to help people. So whereas some other animal-assisted therapy groups focus on just one facility, we go to a lot of different places. So we go to hospitals, schools, prisons, community organizations, and we work with people of all ages and different backgrounds because, as Julie said, animals touch people in a different place, and that kind of connection happens regardless of things like race, gender, age. So
how do you find people to help?
Facilities apply to have Itwet services, and we, in fact, sadly have a waiting list right now because our services are so in demand.
Do you go into like nursing homes and stuff like that?
We generally don't. Part of the reason for that is we do have a requirement that our Itwet animals go to places where other animals are not present, and a lot of nursing homes have, and we're happy they have, changed policies to allow people to bring their animals with them. Mm-hmm. But because we don't like our animals to be in facilities with other animals, we generally don't go to nursing homes.
So how many Itwet animals do you have?
Right now, we're a little bit over 90 dogs, 6 cats,
dogs.
and a bird.
Dogs, 6 cats, and 1 bird. You don't have like fire ants or anything like that?
No fire ants. They're not very cuddly.
Lynn just like, oh no, he had to go there and say something stupid like that.
Domestic animals only are preferred.
Okay, so you don't do like rabbits or
We don't, but there are other organizations that do.
That. Okay, and so how does it work? Let's say I am in hospice. So how does that help somebody who's in hospice? What's the process that you go through with that?
Well, Itwet doesn't actually go to hospice But if we were doing, for example, the program that Julie talked about at Health South, part of what the therapists do is they use the animal as a tool for occupational, physical, speech therapy. So, for example, if someone had a stroke and they were rehabilitating from the stroke, the therapist might have them brush the dog with different brushes and combs to work on the motion, particularly on their weak side. They may have them stand up at the table to do that, so they're working on bearing weight and standing up. They may throw the ball and have the dog fetch to work on that range of motion. And they may do things like encourage the patient to ask the therapist volunteer questions about their dog to help them speak. And practice saying different things and getting back in the habit of that speech and the thought that goes along with it, and also testing their memory a little and having them work on that. So, do you remember which dog was here yesterday? And can you tell me what the therapist volunteer told you about their dog? What breed are they? How old are they? Basically, finding all different ways to use the dog as a tool to help the patient improve.
Okay, before we get too far into this, and I want to plug it at the beginning and I want to plug it at the end and plug it anytime you want to, Lynn, tell us a little bit about the fundraiser that's coming up.
Well, every year, TheraPet holds their annual gala, and it's called Unleashed. TheraPet Unleashed. Well, this year, it's TheraPet Totally Unleashed.
Come on over. Hi there.
She's working the room.
Yeah, she's working the room. TheraPet Totally Unleashed this year is going to be more exciting. We're at a new venue. We're going to be at Bushman Celebration Center on October 14th. It's going to be more of a party atmosphere, kind of a country western theme. We're going to have local talent like Texas Rebellion there. We're going to have food will be provided by the 1836 Texas Kitchen, who puts an incredible spin on regional Texas fare. And we're going to have a live auction. We're going to have a silent auction. We're going to have a casino. Keeper Saw is going to showcase some of their distillery drinks and signature drinks.
Did you just say distillery drinks?
Yeah.
Have they gotten into that now?
They have rum, vodka, and bourbon, and it's delicious.
It's pretty good.
You should go out there for a tour.
Yeah.
Okay, let's go now. I'll see if the technician can load this up into some mobile. They have mobile studios.
Sure.
We'll just finish this off down there at the Keeper Saw and Bushman or whatever.
I think they've had a distillery for over 3 years, and they do. They do tours on Saturdays, like every other hour. One's the distillery tour and one's the wine tour.
I know we're way off track at this point, but where do you get it? Where can you find it?
Fat Dogs has it out or you can just buy it at their distillery.
Mm-hmm.
Okay.
On Saturdays only. Saturdays, of course, not Sundays.
Okay. So, well, PP's just flopping.
Okay, nobody's paying attention.
She just fell over and is lying on the floor.
Dang, nobody's paying attention to me.
So, okay, so
but this is our major fundraiser. This is where we get the majority of our funds to keep our operations going so that we can facilitate all the requests that we have for TheraPet. We go to all the major hospitals. We go to Boshears, Chapel Hill.
How does a TheraPet work inside the hospital? How does that work?
I'll let Carrie Ann tell you about that.
Well, when we do visitation at hospitals, part of that is that the volunteers take their specially trained animals from room to room and greet the family members and the patients there. And a lot of times we hear from patients that they haven't had a visitor during their stay or haven't had a visitor in a while or are just really missing their pets at home. And so it is nice to be able to bring a little ray of sunshine into the room in the form of a furry package.
I think one of the coolest stories I remember from over the years is we went and visited a patient who was post open heart surgery. And we had visited him before his surgery. Like the night before his surgery, we had gone into his room and visited him. And then we saw him a week later after surgery, and he said, I have to tell you that the only reason I made it through surgery was because you brought the animals in the night before and reminded me that I had to get better in order to go home and take care of my own animal.
That's pretty good. Okay, so you, and also, let's see, I'm going back on my list. How do you work with the community organizations?
Well, a couple of the community organizations we go to are the East Texas Crisis Center and the Children's Advocacy Center of Smith County.
Okay.
At the Crisis Center, we are part of their positive parenting program, so the parents and children interact with the dogs together, fetch and games and brushing and petting and putting barrettes in the dog's hair and things like that to help build that relationship. At the Children's Advocacy Center, when children have been victims of abuse, a lot of times it's difficult for them to tell their story, and that is part of their therapy. And we've had some great successes in the past where a child hears the dog's abuse history, particularly dogs who have been rescues. Hears a little bit from the TheraPet volunteer about what the dog has gone through, and then the child feels a little more comfortable sharing their story, and in several cases have whispered it to the dog first before they told it to the therapist, because the dog is non-judgmental. And I would also add at the Crisis Center we have a READ program, which is reading education assistance dogs, where the children work on their reading skills by reading aloud to a dog, where that non-judgmental thing is really helpful as well.
That's brilliant.
Yeah.
And what about prisons?
Prisons. Well, we go to Skyview. And at Skyview, the men and women who are there, part of what they do is they have an occupational therapy program there as well. And they make the bandanas that we sell at TheraPet. And when we go there for visits, the occupants, residents who have been behaving well and have no concerns, get a chance to pet the dogs, scratch their heads, throw the ball for them as well. And a lot of times we hear things like, I haven't seen a dog in 20 years, and they really look forward to it. And a lot of the residents talk about the fact that it really keeps them on track because they look forward to seeing them.
It's used as a behavior modification program. They're not allowed to come visit the pets unless they've done everything they're supposed to have done.
Yes.
And so, and the animals only come down every 2 months.
Yes.
So there's a 2-month period where they have to behave themselves in order to get the privilege of going to visit with the therapy animals.
Okay, well that's great. Where else do you take them?
We go to Rusk State Hospital. We go to Beckville, where we have a READ program at their school. We, as Lynn mentioned, go to Boshears. Chapel Hill, where we work with special needs students as well. Let's see, am I leaving anything out?
Mother Francis, East Texas Medical Center, UT Health, Northeast.
ETMC Jacksonville.
Okay, and that's great. And you've got a waiting list at this point. What would you need is to get in place in order to fulfill that list?
The main issue is more volunteers. We have been very fortunate recently to have a lot of volunteers without animals come into the program, and they're very helpful at events and at the facilities in terms of helping everything run smoothly. But ultimately, we can't run the program without volunteers with trained animals.
What's the youngest that you'll take a volunteer?
Volunteers 16.
Okay.
And the requirement on that is because that's what the hospitals require.
Okay.
So.
Because I've got a 15-year-old that would be probably pretty good for that, but he had turned 16 till next January, so it's tough.
Yeah.
Okay, and so are there any other services that you guys haven't covered yet?
Well, we also go to community events, which is partially goodwill and also partially promoting TheraPet and what we do and helping people know that we're out in the community, because part of our mission also is to make sure that the community is aware of the benefits of animal-assisted therapy and that we're here.
Yeah, you just have to call and fill out a form and...
Okay. Yeah, I've seen you guys at a lot of these events, and I'm always drawn to. That's like the first. Oh, the TheraPet dogs are here, so I'm going over there.
Absolutely.
Now you have a bird, so
We
I
do.
need to know what's going on with the bird in the program.
Cuddles is very popular at the prison.
Yeah.
So Cuddles,
Cuddles.
Yes. There are a number
What kind
of
of
people.
bird is it?
Umbrella.
Bald eagle.
Cockatoo.
No, not a bald eagle.
Not-
Legal name Cuddles. It's a bird of prey.
But I will say there are a lot of people who say I don't like birds, but I like Cuddles. So Cuddles is special.
What kind of
for
bird is that?
Umbrella cockatoo.
Umbrella cockatiel.
She's
Is that one of those
beautiful.
big white ones? Okay.
Yes.
And she's sweet?
Yes, very.
Because I know some of those kinds of birds will bite your finger off if they
No.
get a chance.
No.
So how do you
Very, very
train Cuddles to do Cuddles' job?
We were actually fortunate that Cuddles' owner did a very good job of training her, and when she's evaluated, she's done very well. So
Does she? Are those the kind that talk and say stuff?
I don't believe
I've never heard Cuddles
talks.
No, I don't think she
Yeah,
does.
I've never heard her.
Talks.
The
She
cockatiel
makes little
team.
noises, but I've
Uh-huh.
never heard her talk.
And the cats. What's up with the cats?
We have one volunteer who, in fact, has been featured in the Tyler paper as a cat whisperer. She's amazing at training cats, and all 6 of the TheraCats are hers.
And she volunteers with them at the rehab hospitals, so they're
Regularly.
the tool or piece of equipment that the patients are exercising
Because
with.
I imagine they're a little bit harder to. I don't know.
Her cats are
Her cats are amazing,
Amazing.
Incredibly well trained.
and she says they're not that hard to train.
Really?
But she is a cat whisperer.
These cats get on the table and don't even act like cats. I mean, they want to be touched. They just lay there and soak it up. It's weird. It's awesome because it helps cat people patients.
That's interesting. So, Julie, tell me, how did you get involved with this? What's your story as far as, because obviously this is something that's near and dear to your heart. Why is it that?
I'm a nurse, first and foremost, and I was, another nursing friend of mine knew that TheraPet or the therapy animals were going to be coming to Tyler. And so we went to that very first seminar that was held at the hospital, and I learned what I could do. And at that time, I would say I wasn't really a dog owner. I just had pets, and I didn't really think about, what else I could do with them. But when I heard the difference that the animals could make in a patient's life, and I thought about my role as an ICU nurse and what we could possibly do with some of those ICU patients, I was on board. I was like, we've got to try this. And so it's just been amazing, and the things we've learned and the things we've seen over the years by just bringing in an animal to a patient's bedside has been outstanding. Miracles have happened. I mean, we see miracles every time we go to the hospital.
Tell us a couple of.
Well, I mentioned one earlier, the patient, and this patient, this is a long time ago, but a patient was in a coma. She was responding by moving around in the bed, so it was obvious something was in her head, but she would not respond to her family, she would not respond to the doctor, she would not respond to the nurses. And so her family said she loved animals. So we put one of the dogs in her bed, and I believe it was one of my dogs, I think it was Splotch, and we had her lay her hand, I put her hand on the back of the dog. And I just said, we brought a special friend for you. Now you have to understand, she's on a ventilator, she's on a lot of IVs, she's not responding at all. Eyes are closed. And I said, I just want you to feel the fur, and I want you to see if you can scratch him. Now the nurses had been asking her to do things for days, didn't do anything. And all of a sudden, within a minute, her fingers started to move, just ever so slightly, and she was scratching the dog. Within the 10 minutes that we spent, by the time we were done, she was using full arm motions and brushing the dog from head to tail.
Wow.
Eyes still closed, not even opening her eyes, not like turning her head to her family or anything, but she was doing that. And the very next morning, she woke up out of her coma.
That's incredible. I
It
want
was-
to hear
it was
more
amazing.
stories like that.
It was amazing. I think I've got tons of them. I think about some of the families that we interact with too when we go to the hospital. Sometimes it's not the patient we see, but it's the family. And, a lot of times there's very sad things happening in hospitals. And one family in particular, I remember the nurses said, oh, don't go in that room. They were on the cancer floor. They said, this is end of life for that patient and the family doesn't want to be disturbed. And we said, okay, fine. As we walked by, one of the family members stepped out of the room and just squealed. It was like, oh, look at the dogs. Turned around, went back in, and got the patient's spouse to come out and visit with the animals. And that spouse just lit up. I mean, she was obvious she'd been crying, and she spent like maybe 5 minutes visiting with all the different animals that were there, because at the acute care hospitals we go in a group, so there's usually 3 to 5 of the animals there, and she visited with all of them. She was holding one of the small ones, and she just said, with tears running down her face, you have no idea how this has lifted my heart this evening. I'm losing my husband, but I remember that there is now life, and life that I need to continue on my own.
Wow.
Yeah, so I mean, we as volunteers are blessed with these little tiny miracles every time we go in the hospital. And thank you for giving us the opportunity to share our stories, because there are many of them. And, I'm one of, 100 and some volunteers, and they all have seen just miracles that have occurred.
I think one of my favorites, and we go to Mother Frances every Wednesday night, we always start out in pediatrics. And there's a lot of sick little kids there. And some of the children can't really enjoy the dogs, but their parents really want them around. And when you walk in that room, to me, Julie, I don't know about you, you can just feel the parents, you can just feel they start to relax. The tension it's gone.
Smiles happen, laughter happens, tears dry up.
The children smile, they laugh, and the parents will be the first to take you aside and say, "Thank you so much for coming. You've made our evening."
One of the children on pediatrics he'd had surgery. I don't remember what it was. He was about 10 years old, and at 10, pain, I'm not doing it. No is going to come out of your mouth a lot. And the nurses wanted him to walk. I mean, that's the important thing after surgery is you get up, you walk, you get moving. So you don't get pneumonia, you don't get the complications that happen after surgery. And he refused. He would not get out of bed. And so the nurses saw us coming with the dogs and said, "Hey, would you mind asking this little boy if he'd take the dogs for a walk?" And so I went in and I said, do you want to take, I don't remember who it was, probably Huck. I said, "Do you want to take Huck for a walk?" And he said, "No." And I said, and I got a real sad look on my face, and I said, "Well, Huck really wants you to take him for a walk. That's why he's here." And the little boy was like, you could see him rolling his eyes, and he was like, "Fine." And he got up. He walked probably 80 yards down the end of the hall, and I said, "Would you like to throw the ball for Huck?" So he threw the ball, probably, another 10 minutes. It was 20 minutes later, and I'm like, "I gotta go. We need to wrap this up. We need to leave." Because he would not then now go back to bed.
Now he's not.
Now he's like, "I'm happy, I'm out of bed." And the nurses were thrilled because we had done that. We also had a patient in the emergency room who had diabetes, was very, very sick with her diabetes. The nurses are trying to start an IV. They can't get the IV in. She's glued to watching what they're doing, trembling and crying and staring, and her mom is freaking out. And the nurses said, "Hey, would you bring the dogs in here and see if you could distract her from the IV start?" And so brought the dogs in, staring at the IV. Next thing you know, she's turned her head to the opposite side to look at the dog. "Hey, Mama, look at the dog." We're there 5 minutes. The nurses start the IV, draw the blood, get the fluids running, which is what she needed because she was deathly ill. And she didn't even whimper, didn't even notice, didn't see any of it happening, and and never turned back to where the IV was happening and the pain, but was there distracted by the dogs.
Wow. Do you have a favorite story, Carrie Ann?
My favorite story that I actually witnessed was a special needs student had a headache and was very distraught while we were visiting one of the schools. A teacher was having a hard time calming him down. He was clearly just in a great deal of pain and not very verbal. And so the teacher was troubled, tried taking him to the restroom, tried a cold cloth on his head. They were trying to reach his mother to see if they could give some medication or do something to ease his pain. And the teacher brought him into the classroom shortly after we came in with the dogs. And a suggestion was made that maybe he lay down a little bit on a rug with his head on a beanbag. And he laid down. They put a blanket over him, but he was kind of squirming, and you could tell he was very uncomfortable, crying. And then one of our volunteers suggested that she lay her large Labradoodle next to him. And he eventually kind of wove his fingers through the Labradoodle's hair and kind of put his head up next to the Labradoodle. And about 5 minutes later, he was asleep next to the dog. And that's where I think you see that moment of comfort that an animal can give, that you're not necessarily, we weren't thinking that's what was going to happen. We didn't know what would happen, but it's, there's a connection there and a place that an animal can touch by being warm and cuddly and non-judgmental and just present. And it made a big difference for this little boy. And the teacher was like, "We have to take a picture and send it to his mother because we were asking about medication." And apparently he got medication in the form of Murray. So
that's so cool.
Yeah.
The I would say the sequel to the story I told about the little girl with the IVs who had diabetes was about 3 months later. She was back in the hospital again, and we visited her in the hospital. And her mom asked one of us to step outside the room while the dogs were visiting. And she said, I have to tell you, since that day in the ER where you brought the dogs when she was so sick, she has not been afraid since that day to get her injections or have her blood drawn. And she gets her blood drawn twice, 2 or 3 times or more a day. And she said she has not been afraid since you brought the dogs that day.
Wow. So, looking into your crystal ball, Carrie Ann, where would you like to see this organization go in the next 5 to 10 years?
I would really like for TheraPet to be known nationwide as really setting the best practice standards for the field. I think we work very hard to be very aware of the needs of particularly healthcare organizations and being on top of what we need to do in terms of infection control and following policies and procedures. And so I think we should be writing the book on how to do it. And I'd really like to see us doing that. I'd also like to see us eliminate the waiting list and be able to serve everybody who needs us, because I think a lot more research is being done to show that these stories aren't just anecdotal. There is more and more science to back up what we see.
So how does one become a volunteer?
Well, our requirement is that a volunteer
it sounds like a pretty cool volunteer
It's
job,
a pretty
if you
cool.
ask
It
me.
really is. I always say it's like Julie said, it's witnessing miracles every day. But basically, to volunteer without an animal, all someone needs to do is come to one of our orientation sessions, and the next one is on June 15th at the TheraPet offices at 225 East Amherst, Suite 200, from 11 a.m. to 1 p.m. They're about every other month. We offer an orientation session. If they're looking to volunteer with an animal, particularly if they're looking to volunteer with a dog, since those are the majority of our animal volunteers, they have to have completed their Canine Good Citizen test, have successfully passed that test, which usually requires at least intermediate obedience and more frequently advanced obedience classes. And then they go through a training at the TheraPet Center on skills, working with the equipment in the hospitals and schools and things that we encounter, and how to do the skills necessary to be a TheraPet in all of those facilities. And then they have a temperament test, and then they do an apprenticeship where they work with a mentor who's an experienced volunteer who helps them apply those skills in the real facilities and real world situations. So it takes about a year. For a lot of people, it takes more. For a lot of dogs, it takes more. It depends on the animal and the person, because it is very important that our volunteers train their own animal. It's not they bring their animal to us to be trained. So
And we actually thought about doing that with our Great Pyrenees, which they're knuckleheads and they don't do what you tell them to do. So they're very loving. He'd make a great animal that people would love on because everybody's drawn to him, but he's just like, they're not very trained. They do what they want to and so forth. So we only have about a minute left. So I want to make sure, Lynn, that you
Okay.
plug the upcoming event in October.
TheraPet Totally Unleashed is October 14th at 7
It's like-
o'clock.
I can hear like a heavy metal soundtrack. TheraPet Unleashed.
At Bushman Celebration Center.
And that's and what's it going to be, and who's catering it, and
Catering is going to be provided by 1836 Texas Kitchen, I believe is the official name of that. We just call it 1836. And then the entertainment's going to be provided by Texas Rebellion. They're a local band here in East Texas. We're going to have live auctions, silent auction, casino. We're going to have signature drinks from the Keepersall Distillery, plus in addition to their wonderful wine. And we're just going to have a bunch of fun that night. It's going to be more of a party atmosphere. We're going to have some dancing, and so put on your good jeans and your boots and come on out and do some boot scooting with us.
are tickets available now?
Tickets are available now.
Where can people find them? How much
We
are they?
will have them online probably within the next 2 weeks. We're working on our logo. This year, TheraPet Totally Unleashed is sponsored by Tyler Ford.
Cool. And how much are tickets?
$125.
That's pretty
Or
good.
you can sponsor at different levels.
That's great. Anything else you guys want to add?
come out and support us on
Crickets
October.
chirping.
Love it.
Covered it all.
There will be TheraPets at
There will be
Unleashed
TheraPets
as well,
at
which is
TheraPet
always
Unleashed, yes.
nice to be able to.
Who's your-
How often do you get to pet a dog at a
At
gala?
a gala,
That's
yeah.
right.
I mean,
That
come on.
sounds like a lot of fun. Well, thank you so much for coming on.
Thank you
you.
for
Thank
having
you for
us,
having us.
Brian.
Well, that will do it for this week. I'm Brian Pearson. You've been listening to In Touch with East Texas, and we'll see you next week.
You've been listening to In Touch with East Texas. For questions and comments, please call 903-581-9966, Monday through Friday between 8 a.m. and 5 p.m. Please join us next week for another edition of In Touch with East Texas.